Hello and namaste. This is Dr. Sreenivas Kumar wishing you a very good afternoon, and I welcome you to the COVID Care series presented by Apollo Hospitals. With the COVID pandemic sweeping across the country and many states now having imposed lockdown, it is a time of struggle for all of us. But the only way to cope with this pandemic and all the stress that it causes is to stay informed, aware, and deal with it calmly. But that's easier said than done, right? It is even more concerning for people with pre-existing diseases and conditions and non-communicable diseases such as heart disease, diabetes, hypertension, cancer, kidney or liver ailments. These are called as comorbid conditions. Should people with these conditions take extra precautions? What will happen if they get COVID-19? Will they be at risk? Will it be very severe? How can they get their normal regular treatments for their diseases done during this time? So we have these special episodes in the COVID Care series that focus on each of these non-communicable diseases, and we discuss how to deal with COVID in these situations. So today we have a very special episode, which is managing heart disease during the COVID-19 pandemic, and also how the heart itself is affected when somebody gets COVID. I'm very happy to welcome Dr. A. Sreenivas Kumar, Director, Cardiology and Clinical Research, Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Sreenivas Kumar is an eminent senior consultant cardiologist, and he's also a professor of medicine at the Apollo Institute of Medical Sciences. He is the chairman of the founder and director and CEO of FACS, Fraternity of Advanced Cardiovascular Techniques and Solutions. He's the founder director of TCT India Conference, CSI NIC chairman for the year 2018-19, and he has been the past president of APCSI. Hello, doctor, and welcome to this FB Live special session. I request you to begin with an overview on heart disease management during the time of COVID, what precautions should be taken by such patients, and I'm sure you'll also discuss what would be the severity of COVID in these patients, what are the treatment modalities, vaccination strategies, and even another angle would be how these patients can access cardiac care like follow-up or investigations or treatments during this time of lockdowns and pandemics. Dr. Sreenivas, over to you.
Namaste, good afternoon. I am Dr. A. Sreenivas Kumar, cardiologist here. Thanks, Dr. Sreenidhi, for your kind introduction. And today's session on COVID series is very important because it is dealing with non-communicable diseases and interactions of COVID with various types of heart diseases. As we all know, we are all going through tough times of this COVID, and the COVID second wave is on the rise. We should congratulate Apollo Hospitals for taking out all measures and taking care of not only COVID patients sick and being referred from all across, but they take special care in treating non-COVID patients who have cardiac diseases, be it the acute myocardial infarction, heart failure, and many other emergencies which come to the hospital. I should again appreciate the efforts of Apollo management for streamlining the process and getting these acute MI patients, ACS patients streamlined in a separate manner through separate ERs, and so that the cross-infection, the worry of the regular patients getting COVID in hospital is taken care of. In bigger setups like Apollo Health City, where it's all separate building itself, there's less of worry. But even otherwise, Apollo has channelized and made separate arrangements to take care of the sick cardiac patients. So I would like to start with this positive note for all these patients who, if at all, with the various preventive measures, you fail to get into prevention, but get into acute trouble like acute MI, a heart attack, unstable angina, heart failure, approach the hospital on time without any worry of getting cross-COVID infection. And we take all measures to treat all of you in time. And we are very proud to say that recent our analysis showed that our door to balloon times, which is a marker of how cardiac care is delivered to the acute heart attack patients were in less than an hour's time. Internationally recognized recommended one is 90 minutes, but we could do it even in less than that time because of round-the-clock availability of cath lab personnel and cardiologists. And we do have 2-3 cath labs. One is segregated exclusively for doubtful or COVID patients. Other one was for COVID negative patients. I think this is a positive note, and I want to reassure all the patients who are in need of cardiac problems to come to Apollo without any worry of getting a COVID infection. That is about patients who are needing services, non-COVID patients. Coming to the COVID interactions with the heart diseases, as I said, COVID, a small virus, is creating so much havoc of problems across. As we all know, it tends to affect all systems in the body. It goes through nose and mouth and the respiratory tract, and then enters into the through receptors, say angiotensin receptors. It enters into the blood circulation and then gets and distributed to all the parts of the body. So wherever there's blood circulation, this organism is tending to do troubles. So first of all, if you see, as we are concentrating today on cardiac diseases, without going on to too much lung and other manifestations, I would stress upon COVID manifestations of various cardiac problems. Once it goes through, then it reaches a circulation. It can have varied type of presentations. One is if it gets infected, and the main blood vessels of the heart, which are actually 3, 1 on the right side and 2 on the left side, if they get affected and clots form, the patient will present with acute myocardial infarction like any other acute heart attack. But what we also see with COVID infection is not only the large vessels, but the smaller thin vessels get affected, and patients come with diffuse changes, and then ischemia manifests. And these patients could also, when you take up the angiogram, they could have significantly no major blocks, but diffuse disease type of a picture also is seen. That is because of diffuse inflammation happening in the small vessels. They would manifest themselves with slow flows and distal thrombosis and things like that. They could present with just LV dysfunction, heart pumping becoming less. Other commoner presentation is the virus directly affects the myocardium of the heart, and that's how they present like a myocarditis like picture in heart failure. Again, the enzymes called troponins go high, elevated. Initially, cardiologists were getting infected, not knowingly. They were thinking as a cardiac patients and going and seeing with the patients without PPEs. Some of the cardiologists got affected with this problem. That is because of this reason. The myocardium, which gets infected by a COVID muscle, releases troponins, which actually get released in acute heart attack stage. So that is another presentation which can happen. Just asymptomatic rise of troponins could also happen in some minor variations. The other important aspect which can happen with COVID is heart has a layer around the heart called pericardium. So there could be some fluid collection around that heart called as pericardial effusion, which generally used to happen before with tuberculosis and other things. That sort of presentations also we have seen. Inside the heart, there is a conduction system called electrical system, where the current generates in the heart, and heart beats every minute about 70 times. So the current system, conduction systems also could get affected, and the patients are also seen with presentations with low heart rates or higher heart rates. Low heart rate is called as bradycardia, and the higher heart rates are called tachycardia. And in between, sometimes because of myocardium gets inflamed and irritated, they would also present with ectopic beating and sudden abnormalities in the beating called ventricular tachycardia and fibrillation, which could be catastrophic and lead to sudden cardiac deaths in some unfortunate patient. But fortunately, this is less and less common. Apart from this direct cardiac manifestations, there is also what is noted is a clotting system gets into imbalance in the body. So the bleeding and clotting, which always go hand in hand in the human body, gets disturbed, and you see clotting mechanisms happening in various parts of the body. In the veins, it clots and it goes into the lungs through pulmonary arteries. So that is called as deep venous thrombosis. And when it goes into the pulmonary artery, the pulmonary thromboembolism happens. So this is another manifestation which is seen in some rarer type of patients. That is the DVT, sudden clottings happening. What we hear in the news is what is DVT followed by pulmonary thromboembolism. And one more, which is relatively funny thing which is happening with COVID-infected patients is patients do get into hypoxias, and nowadays, because of COVID, this saturations, pulse ox has become routine household affair now. That's a good thing. Health education is important. But you need to also understand why these saturations are going down in the blood in these COVID-infected patients. One standard way is when it goes into the lungs get infected, and then where oxygenation happens in the body, that gets affected, that's where oxygen saturations go down. But apart from that also, what is noted in the COVID patients is what we call it as happy hypoxia syndrome. What happens is the oxygen which is carried in the red blood corpuscles, one of the blood cells in the body, also gets disturbed. And this oxygen carrying capacity in the blood, the RBCs are getting disturbed. So in spite of giving all the oxygenation, ventilation, still the saturations tend to get low. But fortunately, it is seen in relatively sicker patients. So suddenly the patients don't know it. They don't have dyspnea also because the lungs are not involved immediately. But suddenly when the saturations go down below 80, suddenly they'll get into heart attacks and then also acute stopping of hearts called cardiac arrest. This is what we occasionally see in some patients who present late. So that's why it's always important to check your saturations, and saturations not only at rest, on little walking also. The saturations are going down below 90, you need to be careful and report to hospital where the treating doctor could decide about taking CT scan of chest and things like that. So the other manifestation what is there is happy hypoxia syndrome leading to sudden cardiac arrest. Lastly, what I would like to also mention is these patients who suffer with these type of problems, once they get into heart attack or get into myocardial dysfunction, they will also present with ventricular tachycardias, VT, VF, and then with blood pressures falling down. And when they go into last stages where the pumping also gets affected, BPs fall, it is called as cardiogenic shock type of situation. That is the most difficult to treat, where we take the help of ECMO and other pumps to improve these patients' outcomes. Lastly, when all other parts of the body gets involved, it is like called a SARS type of inflammatory syndrome, where along with the heart, lungs, the kidney, liver, everything gets involved. That's where the patient goes into multi-organ failure. And when the other infections also happen, he'll go into sepsis, and that's how the patients die in the end. So to list out, though I have listed out so many manifestations, fortunately, what I would like to reassure all our public is all these things happen in less than 5% of the totally infected COVID patients. That's a good thing. The latest variants which are worried of is also more infective, but it's not dangerous. These manifestations don't happen that commonly, fortunately. And though overall number of hospitalizations is going up because of huge number of infected population, the percentage of patients who become sick after infection, that has not gone up, luckily. So this is something blessing in disguise, like little pleasurable news for us to note. But it's always important for us not to get into the risk of getting COVID infection. So to just to enumerate before I close down the various COVID manifestations are in the heart, it could be standard acute heart attack, or it could be small vessel involvement with slow flows, or it could be myocardial infarction or a myocardial dysfunction, where directly the myocardium heart muscle gets damaged, inflamed, and then there could be fluid collection around the heart called pericardial effusion. And the current system within the heart also could get affected, leading to low heart rate or higher heart rates. And in the terminal stages, where the patient becomes very sick, along with the failure of all other organs, he could also get into cardiogenic shock types of situations. So these are some of the various manifestations of COVID and heart. But what I would like to reassure is all these are relatively rare. And most of the times, 95% of the times, you don't get cardiac involvement in many of these patients, unlike lung, which is more commonly involved. These are the COVID cardiac manifestations. Now I'll come to some of the NCC.
Doctor, can I just ask you this before you continue?
Yeah. No
so there is also, there is not much known about, like which are the patients who actually get these kind of complications? Are there any particular subsets of the population who are more prone for these kind of either the lung? Because we see a lot of people who just get the COVID and then they just finish it at 10 days and they're done. But there again, somebody even in the same family, like, they might be having this drop in saturation or a lung involvement or the coagulation or the heart. So is there anything that we know now about who is more prone for the complications of COVID?
Yeah, that was the second part. I was coming to it. Thanks for making it.
So
basically, which are the subsets of patients which will land in trouble and get into these so-called manifestations, what I mentioned? That is the issue. And all of us should become aware. That's where I think we have identified some of the risk factors, what we call, where once the COVID infection happens, first of all, the chance of infection coming into them is more if you have the following. And once it gets infected, the chance of becoming sick and also getting into complications is also more. If you have to label them by order-wise, most important is the elderly age. People who are more than 70 years of age, probably have more chance of getting into trouble and more chance of acquiring infection. If they acquire infection, they also tend to get into complications. Number one, the most significant problem one is elderly people. And number two, people who have the comorbid pathology. Comorbidities is what we are talking of today, is like hypertension, diabetes, high cholesterol, people who are little obese, and people who have some pre-existing lung problems like asthma and COPD, and people who have pre-existing minor kidney diseases, which are called as chronic kidney disease. These are the subsets of patients who tend to get affected more. And suppose patient already had suffered an old heart attack or old bypass surgery is done or stents done before, with pumping function being less in the heart. Again, that is an important subset of patients where we need to be extremely careful, because minimal infection happening also, heart won't be able to tolerate it. So to enumerate the risk factors again, the elderly age, hypertension, diabetes, high cholesterol levels, then probably people who have associated asthma, COPD, and associated kidney disorders. And any patient who already suffered an old heart attack or has suffering with the heart failure, again, you should be careful. These are the subsets where we need to be extremely careful. Then the question comes many of the times when the patients get COVID, unfortunately, the doctors or the patients themselves are neglecting their original treatment of cardiac drugs and taking only the COVID medication which is prescribed. This sometimes is done unknowingly by some treating doctor also, or patient by themselves think they are taking too many tablets and neglect that. So this shouldn't be done. That is a definite deathbed likely to invite complications. Never ever stop the old cardiac medications which you're taking. In fact, there was some controversy regarding the antihypertensive tablets like ACE inhibitors or receptor blockers, whether to be stopped or not before. Now it is proven beyond doubt that they should not be stopped. In fact, actually, if you stop it, the mortality could increase. So all these pre-existing medication should be taken regularly. And these are tough times, stress times. Whenever there is stress and tough situations, all the cardiac medication should be taken more. In fact, the benefit would be much more if you take it properly. So whether you are taking COVID treatment or a COVID vaccination also, none of the things that pre-existing medication should be stopped. And all these people should take their cardiac medications regularly, along with taking the treatment of COVID from the concerned specialist. I would also request our viewers, all of them, to take appropriate opinions and treatments from proper physicians who are experienced in treating COVID, and not to get a treatment of various types of fancy drug treatment which are poured in these patients. Many of the times that may not be needed. There are some specific guidelines and criteria by which you are supposed to give specialized drugs. I request all of the viewers to get into more details in other sessions, or data is available. So, but suffice to say that don't discontinue any cardiac medication and take even the COVID medications regularly with prescribed along with the pre-existing cardiac medication. That's what I wanted to highlight. And patients who are taking COVID vaccines also, many of the times get into questions we get thinking that whether should stop this medication. None of the medicine should be stopped. In fact, even if you take COVID vaccination on the day, also you could take these medicines and take vaccines. And some doubts are shown in these patients that vaccination in cardiac patients could lead to trouble, and the clotting happens in some of these patients. All these funny things get floated out in the WhatsApp and social media, which is of less importance. And very rarely, 1 in 5 lakh, somebody had developed some clot which was very minor. So you need not worry about it. The benefits which are offered is much more. 85% of population taking vaccine is protected. And the only way the US could control this epidemic is they could take the vaccines regularly, and 50% of their population taken the vaccine. That's how I think they are doing fine. So in our country, unfortunately, people neglected taking vaccination before. Now they are all wanting to take, but there is some short supply of vaccines, it appears. But hope it all comes through, and request all the viewers to get themselves vaccinated as soon as possible. And whom should take vaccine, whom not to take vaccine? There's another question comes. What government made initially is elderly people who are more than 65 or more risk factors that are already given. And anybody who's more than 45 with a comorbid pathology is what we described already to be taken. And comes to the next question is whether 18 to 45 years age also can take. There's nothing wrong in taking, but because of a lack of proper supply of vaccines, government is not able to provide for them. But if you have it, you can as well take it. Less than 18 years and pregnant women, we don't have data as of now, but studies are going on in children and pediatric population also for the vaccines in future. But as of now, anybody who's more than 18 years and non-pregnant females can take this vaccine. And in fact, this is the only way you can protect yourself without worrying about complications of vaccines. I think this point also I wanted to highlight about vaccines and the treatment. I think with this, we can take some questions, madam.
Yeah. So we have some questions here and we will get more in the yes. So this is, I have a heart condition. Am I more at risk of getting COVID than somebody who doesn't have a heart condition?
Yeah, that's what I mentioned. So people who have heart condition, like patients in which have suffered a heart attack, stents, bypass surgery done, and pumping function of heart being less, then they are more prone for a problem with COVID. But if you have suffered some minor problem, you got treated within no time, and your heart pumping is reasonably good, maintained well, then still it will be okay. You don't have that higher risk compared to a person whose heart pumping is weak. But compared to normal person who does not have any heart problem, you have still little more chances of getting into trouble. That's why we request all of you to get vaccinated as soon as possible.
Are cardiac patients who also have diabetes and or hypertension are at greater risk? Are they at greater risk?
Yeah, the more number of risk factors you have, the more of the risk which you'll have. Actually, in fact, the risk is not supposed to just add, but they are supposed to get multiplied. So the more number of risk factors you have, the more care you should take. And especially one more thing, what is noted with this diabetes treatment is in these tough times of COVID, in the stressful situations, even if you're taking the medication or some people unfortunately missing the diabetic medication, they go into very high sugar levels, something like 400, 500 are also seen. That lands into trouble. Patients go into diabetic ketoacidosis and other complications also with COVID infection. So these sugar levels need to be monitored. Apart from the regular medication which we were taking before, they could need an extra tablet or insulin injection during this tiding over process of COVID infection. So that is important for you to take and take a guideline directed therapy and therapy according to standard prescriptions from a qualified doctor. Other questions come regarding the treatment with this clot dissolving tablets, or what you call as antiplatelet and antithrombotic tablets or injections, what is recommended. In general, when the COVID infection comes, if it is generalized, diffused with, there are some markers called inflammatory markers, high CRP, ESR, and I'm not going to all the details, but if the inflammatory levels in the body are high, then there's more chance of clots happening in the body. That's where the treatment with initially with low molecular heparin and followed by the newer anticoagulant drugs called apixaban, dabigatran, or rivaroxaban is being tried. These are specialized tablets and it should be taken only with advice of a specialist doctor. Suffice for you to know that you need to take the specialized antithrombotic, anti-clotting tablets also if required, not to get into trouble of deep venous thrombosis and clottings happening in the lungs and things like that. So it is important for you to take standard anti-thrombotic drugs also along with regular medication which you take. So this is also important for you to understand. Okay, thank you.
Is the risk of developing severe COVID-19 symptoms the same for all types of cardiac diseases, or are particular, like we did talk about the ones where the pumping ability of the heart is affected. So they want to know whether if you have atrial fibrillation or if there are other types of valvular heart disease or other things, which one is more riskier for COVID?
Actually, you have a conditions called high risk conditions in cardiology. There are like one of it is the heart pumping becoming less, and pumping how less? If it is severe LV dysfunction, pumping function is less than 30%, or patient is an obvious heart failure, these will be high risk scenarios. Or the valvular heart disease, if the valvular heart disease has very severe obstruction, this is what is aortic stenosis, where the pumping function of the heart goes down, or the mitral stenosis, very tight block within the mitral valve, leading to right side pressures being high. These all fall into a standard high risk category even otherwise. So all these would be higher risk even with COVID infection. But good thing is if you treat them well, still we have now done a TAVR procedure. TAVR means it's a new trans-aortic valve replacement procedure, which is done in sick patients, COVID recovered. Many of them, they were worried to touch such patients. We did treat this 82-year-old COVID recovered patient in a hospital. Like through groin, you take that valve and deploy that aortic stenosis is opened up, and immediately pumping function of the heart improves, and patient dramatically could improve, and we are successfully discharged that patient. So any sicker condition, without getting worried too much about yourself, and not going to too much of stress and landing in trouble, please get to hospital setups like Apollo where you have everything and cross-check yourself whether there's any treatable element and where the risk can come down significantly rather than bothering too much about what is your risk status.
These are some of the live questions. I'll just read them, Doctor. My father has undergone bypass and craniotomy surgery. How safe is it to go for vaccination? Please provide info.
It is very important for all of you to know whatever types of disease pre-existing you have, unless you are on a blood clot dissolving drugs like warfarin or acetylene or the newer oral anticoagulation. If still that also, if INR is maintained in reasonable therapeutic range, you could still take vaccination. The more sicker the patient, the more benefit you get from the vaccination. Please remember the statement. So however, elderly people, whatever be the age group, whatever be the disease subset you are suffering with, you all benefit by taking vaccination. In fact, we were thinking initially before we became experienced with vaccine for elderly people, whether they would tolerate it or not. What we surprisingly and presently noted is whatever little reactions like local injection site pain or diffuse type of body inflammatory pain and fever feeling and body aches, malaise, things like that also is not happening in elderly people. Surprisingly, elderly people are tolerating the vaccines well. So there's no worry. Even if your bypass surgery is done, even if you had a brain surgery before, unless there is active bleeding or some problem, you can still take the vaccine without any problem. In fact, the benefit would be more and he should be given the vaccine.
My husband is 51. He has undergone a bypass in 2006. He got a brain stroke 3 years back and he's also a diabetic. His creatinine level is also high, 3.16 when tested on 10th April. Now he has been detected with COVID positive and his CT severity score is 12, CORADS is 4. Kindly guide.
That means he already got COVID infection. The pre-existing comorbidities led him to get into infection. And if once your COVID PCR test is done, if it is positive, along with the SCORAD score, which is indirect evidence that he could have this COVID in lung infection.
CT severity score is 12.
Yeah, 12. It is about half of the segments are involved. And then CORAD, so you said as 4. So basically, it is something like moderate. It is not too severe, not too mild. That's where you take the help of symptoms assessment and take the help of other blood markers and then decide about the type of therapy you offer. And once the therapy is given, once he becomes COVID negative, 1 month later, these are the subsets of patients who are supposed to take COVID vaccine. Wait for 1 month because in a month's time, you could still have some antibody protection after the COVID infection and take the vaccine dose, first dose after 1 month and followed by the second dose as per recommended guidelines. Many questions also come if they have taken one dose types of vaccine, whether they can take other type of vaccine because of non-availability of some type of vaccines. That is not true. Whatever type of vaccine you have taken, the second one preferably should be of the same type, same vaccine, because the antibodies effect which could happen could differ from one vaccine to the other. So even if it gets delayed by a few days, still it is okay. Covaxin, normally you're supposed to take after a month. You can stretch it up to 6 weeks. Covishield, now initially when we took it was for 1 month. Now the guidelines changed. Now they said that you can take as a little longer after 6 to 8 weeks because of better antibody protection happened if you take it little later. So even if it is stretched by a week or so, it is okay, but please take the second dose as the same type of the first one. So to answer her question, once the COVID settles after a month's time, you take the first dose followed by the second dose as directed.
The next question, my husband is COVID positive and treatment is going on, but recently had a cardiac arrest. Now brain activity is low. What should be our next steps?
So that is an unfortunate scenario where that is the worst thing which can happen to any patient. This could happen with any heart attack, more so with a post-COVID infection, somebody develops heart attack. And then other organs could also have got infected and got into what is called as multi-organ failure or sepsis type of syndrome. And then the brain also gets affected. And when the heart stops temporarily or beats abnormally, the brain supply decreases. And then hypoxic brain injury happens. That's where they're called as hypoxic encephalopathy. For practical terms, could be called as brain dead patient. Then the options are very limited. But only thing is, depending upon the doctor, they have separate specific criteria to say when to give up, when to continue. And if your patient is young, we try to do our best and try to give all the therapies possible. But options are very limited, unfortunately, in this stage. But if the brain is functioning all right, if you have only heart pumping becoming less or lungs becoming whole white because of non-perfusion and non-hypoxia happening, then you have methods like ECMO, where you put them on artificial pump and artificial oxygenation, thereby actually saturations could improve. Or the heart pumping is less, you also have pumps called Impella and then LVAD type of systems where you can support the heart temporarily. And we have seen some patients improving. In Apollo also, we've used 2-3 patients ECMO and they have improved. So, but unfortunately, we don't have a solution. If the brain is damaged, that's where is the hypoxic damage. Science has not reached the stage there where the damaged brain, hypoxic brain, once it suffers a problem, we don't have a solution as of now. That's a difficult thing to treat. But at the same time, we pray to God, hope his brain recovery happens. And we need to give supportive therapy and continue respiration measures and blood pressure maintaining measures till if brain recovers. But if it is a very poor recovery chance, then that's where we need to take a conscious decision discussing with the family.
Can you told left ventricular failure patient go for vaccination? We have already said that everybody should go for vaccination.
As I said, this is the risk. This is the patient who benefits most by vaccination, because if he gets infected, he will land in trouble. So the only best solution which we have is vaccine, and please go for immediate vaccination.
Could you please mention the manifestations of COVID on a transplanted heart, if any?
So that's again very important and technically more intricate question. Basically, transplant, after transplant, which setting a transplant happened is a different scenario. But generally, transplant is done once the heart is totally damaged, whatever reasons it could be. Once the transplantation happened, then the patients are on immunosuppressive therapy, because the new heart which is kept should not get rejected. That's why we give some drugs to temporarily suppress the immune system of the recipient. That's where the trouble is. When the immune system gets suppressed, whether any minor infection happens, it could manifest more. This is another high-risk scenario where actually we did mention immunocompromised patients, HIV-afflicted patients. These are another high-risk subset of patients where even minor COVID infections could manifest more. So that's where we are worried to give. And as of now, if the patient is on very high dose of immunosuppressive therapy, which happens in the first 1 month of transplant, we tend to avoid, be it be heart transplant, be it be kidney transplant. If the patient is on very high immunosuppressive therapy, we tend to avoid, because we don't want even the minor infection, which is very uncommon, but still could manifest with more. But anyway, we can wait for a month after this. And then if the immunosuppressive dose comes down, then that's where we tend to give them the vaccine. But in the first 1 month of immediate therapy, where vaccine immunosuppressive therapy dosage is very high, we tend to avoid. As of now, there's no clear-cut guideline to definitely say, because we don't have too many tested patients in this subset of patients which are immediately transplanted after the heart. But we do have data after the kidney transplant. We do have the data coming up now in the subsets of patients with HIV infection, where even in HIV infected patients, when they go into quiescent phase, the vaccine can be given. And there's benefit even in the HIV infected patients. But immediately we don't have data in post-cardiac transplant recipient patients. But 1 month it's preferable, as wiser decision to avoid. And later on, once the dosage comes down, you could take it.
There are two, doctor. One is, hello, doctor. My father is 73 years old, got his angioplasty done 4 months before, has a chronic kidney problem. His creatinine is 2.2 to 2.5, having Urimax also for urine problem. He's on A and other medicines for angina. My question is, what are the things we should keep in mind before vaccination? Do we need to stop the blood thinner? Please explain. And even after the vaccination, can he immediately start taking his medicines? And what are the normal medicines which can be taken if he gets fever or cough? A lot of questions there. I think
that's okay. Basically, there's one questions are many, but the answer is one. Don't stop any of the pre-existing medication. These antiplatelet drugs are not the blood thinners which are mentioned. What I mentioned are different. The antiplatelet drugs can be continued. Don't stop any medicine, and take the vaccination as soon as possible. And post-vaccination, if you develop some minor fever or body pains, you could take Dolo or a paracetamol, which is safer. But anybody for that matter, you should avoid taking non-steroidal anti-inflammatory drugs like Brufen, Overon. That's where you land in trouble, especially if your father also has a pre-existing kidney disease you mentioned. You should strong no to NSAIDs. If at all he needs, you should take just paracetamol and try to control post-vaccine complaints. But it's very important for such high-risk individuals who have multiple comorbidities to take vaccination and protect themselves. One, before I think we are coming closer, one clarification and doubt clearance I want to do for all the viewers is, it looks surprising when the questions of that sort come. They have diabetes, they have heart disease, they have bypass surgery done, they have kidney disease, and they have also some paralysis type of problem. Why all this is happening? Why God is so cruel? People must be thinking. So what I would like to mention is, all these have a common etiopathogenesis called as atherothrombogenicity, atherosclerosis. That means the high cholesterol deposits which happen in the various blood vessels. They could be heart blood vessels, they could be brain blood vessels, they could be kidney blood vessels, they could be blood vessels supplying to the limbs. All these have a common pathology called atherosclerosis. That's where the cholesterol plaques form, and then that's atherosclerosis happens, that blood supply decreases. That's why all these go as syndromes. And when diabetes is there, blood pressure is there, cholesterol is there, all these will produce the same atherosclerosis and produce similar pathologies. That's where we are calling them, all of them together, as non-communicable diseases. That means they don't acquire infection from one person to other, but these all have a common etiopathogenesis where these are risk factors which are mentioned, lead to decreased blood supplies, blood vessel problems in the human body, and lead to this trouble. So these non-communicable diseases, apart from these, what I mentioned, the vascular diseases, the cancer can be again clubbed as one more, but the standard non-communicable diseases, what I mentioned, is basically heart attacks, that is coronary artery disease, brain attacks, that is cerebrovascular accidents, kidney attacks called chronic kidney disease or chronic renal failure. Then you have a diffuse vascular disease where you have peripheral arterial disease, where the blood supply to the limbs and the legs also get lessened. And finally, the other type of disorder, which is not communicable, but it could be also classified as non-communicable disease, is nowadays increasing obesity, weight increases, that's where lead to all these problems again, and the cancers, which again increase with increasing age and increasing obesity. So these are all non-communicable diseases. The topic of today also was COVID and these various NCDs. That's all I wanted to highlight before we conclude. I'd be happy if there are questions.
Last question here. This is a patient who has recovered from COVID and has heard that there are chances of having cardiac arrest due to clots. So should they take any precautionary medicine?
Yeah, let us end our discussion with a positive note. What I would like to mention to all the viewers, listeners is, once you got COVID, life is not over. Only very few percentage of the COVID infected patients would land in trouble. What all methods, mechanisms which are mentioned, it's happening in less than 5% of patients. 95% of the patients you would improve. Then in about some 5% of patients, there are drugs which are to be taken regularly to prevent further complications happening. One of the rarest complications which could happen in the heart side is the blood clots forming, where we call as DVTs, and that going into the pulmonary arteries called pulmonary thromboembolism. That's why, that is the reason why we prescribe for COVID patients what is called as NOACs, that is newer oral anticoagulation, be it apixaban, rivaroxaban, or dabigatran. If you take that drug according to the guidelines, maybe generally we recommend them for a month or 6 weeks, then that chance of getting into trouble post-COVID also can be decreased significantly. And then if you have a diffuse lung involvement, that's where you tend to get into trouble with lung fibrosis and breathlessness happening. That also has a guide. Physiotherapy and other exercises has to be given. But most important after COVID recovery is you maintain adequate hydration, adequate nutrition, rest yourself well. Don't keep on thinking, array, you got COVID, you feel some weakness and all that. That is bound to happen in any viral infection, more so with COVID infection. So don't worry regarding fatigue and muscle pain or body aches or weakness which you get. That is not that dangerous. If you take rest, give rest to the body, and then give adequate hydration, take high nutritious food, then gradually everything will come back to normal, and give some time for the body to recoup itself. It might take from 2 weeks to 4 weeks to 6 weeks, depending upon how fit that patient was before he getting COVID infection. And again, don't discontinue any of your pre-existing medication. which you're taking, then with these precautions, you would recover as soon as possible. Other drug therapy, what is recommended in these patients is doing meditation, yoga, and breathing exercises. These are supposed to be good, not only in preventing COVID infections, but it will help a lot in COVID recovery also, where the traditional yoga meditation is supposed to help improve your lung capacity and you recover faster.
I have a question, Doctor. You said about this anti-clotting medicines to be continued post-COVID in some patients, but that's only for some patients, right? Not for the mild COVID and the ones who, so who are the ones who need to take this post-COVID anti-clotting, anti-thrombotic medications?
Yeah, that's a good question. Let us suppose if you have to divide these COVID infected patients into mild, moderate, and severe infections, we have some criteria to say which is mild, which is moderate, and which is severe. It will take more time for us to discuss. But the severest form of the COVID infected patients, where you got diffuse lung involvement, where you had low saturations, where they required longer ventilator support and support with oxygen, and then they also land into comorbidity problems like kidney problems and other associated heart failure problems. These are the subsets of patients which independently require these anti-clotting drugs, but we give them in appropriate doses. If the patient is very elderly, don't challenge them with too much high doses. We give preventive doses slightly on the lower side. This is one. On the other hand, even if the patient does not have severe COVID infections, but if he has a pre-existing indication for such blood thinners, like heart beating irregularity, what we call as atrial fibrillation, or patient has a prosthetic valve, patient has other pre-existing requirement for giving this medication, like patient has put some stent because of clot or some problem is given this medicine. So the pre-existing indications for this newer anticoagulation is there. Anyway, we tend to continue there. But one word of caution is when you're giving this newer anticoagulation to the pre-existing medication, the two drugs which are called as ticagrelor as well as aspirin, one of it needs to be monitored and decrease the dose or stopped when you're giving NOAC. So there's a little more complicated stuff which should be decided by the doctor, but it suffices to say that the severest form of COVID infections or the patients who have pre-existing indications for the newer oral anticoagulation should take that molecule.
No, the only reason I asked the question is because, like since COVID is so different in severity in everyone, so somebody knows that somebody in their family was given an anticoagulant or a remdesivir, they think that everybody should have everything sometimes, and in their concern, they get, so best is to go with the doctor's advice for.
And then if you have a documented evidence of clotting which has happened, suppose somebody, you did ultrasound scan or you did D-dimer test or you some evidence of clotting which has happened in the body, be it with the legs, be it in the lungs, be it in the pulmonary artery, then they are the condition, they are the candidates who require this NOACs more than any other person. But mild infection, patients who do not have much of a complications, all these need not be given this NOACs because they're also double-edged weapons. If you give them left and right to elderly people, it could cause bleeding also. So it should be taken with the doctor's advice. With the other thing, what I wanted to mention before we close is, many of them, with the worry of COVID infection itself, they get into so much of tension, trauma, anxiety. There are reports their patients are developing cardiac arrest, heart stopping, or beating abnormalities developing suddenly because of the worry, anxiety, tension, stress which has happened. One other family member got into trouble. The younger generation lot also is getting into trouble. Please don't think like that. You follow all the precautions, all the social distancing measures, SMS, sanitation, masking, all that. But don't get worried. Even if COVID happens, you can still be normal if you take the regular treatment. And the anxiety and the stress, the cause of worry will decrease your immune system and you land in more complicated forms of COVID. So please don't get into panic mode and maintain your calm and cool. Follow yoga, meditation, and cooling stress exercises, whatever you're doing before, and be calm and maintain cool. Maintain your proper hydration and food intake. Most of the times it passes off. That's the advice which I want to give to all the people who are in these tough COVID times.
Thank you so much for taking all this time and answering all the questions and giving us a good insight into not only heart disease and COVID, but all aspects of COVID. Thank you so much. And viewers, if you have more queries, you can reach out through Facebook Messenger or post some of your questions on the comment section. And I'd like to thank you again, Dr. Sreenivas, for a wonderful discussion.
Last closing word. One last closing comment. What I would like to mention is all the COVID is discussed, okay, but I started with that. I would like to also end with this. Please don't worry yourself. You've got COVID infection. If somebody develops severe chest discomfort or you have a pre-existing anginal problem, cardiac disease, don't wait at your homes without coming to hospital thinking that you will get COVID infection. We at Apollo, we have made all the separate arrangements. Whoever has a separate cardiac problem, without wasting time, you come on time to the hospital, you'll be taken care in separate cath lab facilities and separate places to give you the best possible treatment. If you worry yourself and don't come to the hospital, present very late to the hospital, that's where you land in trouble. Please avoid the delay. And even in these tough times, you could get occasionally heart problems. And don't neglect yourself. Come to hospital, take treatment and time. You will still maintain your health. Thank you. With this, I think we'll close.
On that note, very positive note, we'll close. We will meet on Monday again, the 10th of May, same time, 2 p.m. The topic that we are discussing is Managing Neurological Conditions During COVID by Dr. Suryanarayan Sharma. Meanwhile, take care, be safe, and have a good weekend with all COVID precautions. And don't forget the SMS. I don't need to tell you what it is. You know very well. Thank you. Namaste.
Thank you. Namaste.